Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to touch upon is called peripheral artery disease or disease of atherosclerosis or plaque formation in the arms and legs. This is not a condition that we generally tend to think about when somebody comes to our practice with pain in legs and arms, but we should be doing. What are the symptoms? How is it diagnosed? What are the risk factors? We'll be talking all about it, okay? So basically, peripheral artery disease or PAD is an accumulation of plaque, fats and cholesterol in the arteries in your legs or arms. This makes it harder for your blood to carry oxygen and nutrients to the tissues in these areas. And that's why you start having the necrosis at the end, because arteries, as you would know, are the vessels that bring food to all the parts of the body. So if there is any problem with blockage of that, so for example, if there is any problem in the brain, we get a stroke. There is any problem in the heart, we get a heart attack. Similarly, if there is any problem in the peripheral arteries, we get necrosis of the tissues and we get pain and similar symptoms. So it says PAD is a long-term disease, but you can improve it by exercising, eating less fat, and giving up tobacco products. So here we have already spoken about the risk factors, but we'll talk about them a bit more. But first of all, what are the symptoms? What is considered the first symptom of peripheral artery disease? The first symptom of peripheral artery disease is usually pain, cramping, or discomfort in your legs or buttocks. Intermittent claudication. This happens when you're active and goes away when you are resting. So I would like to talk about that because we do get a lot of patients in the practice with the pain in the buttocks and legs, and we usually think of everything else but peripheral artery disease. So usually the first thing that comes to my mind is deep venous thrombosis, and that is actually, good to think about, because if there is thrombosis in the veins, we can diagnose by doing a Doppler ultrasound scan, and we can treat it by the anticoagulants. So that's the first thing, because what happens is if you don't treat the clots in the veins, what does arteries do? What do arteries do? Arteries bring the food and nutrient and blood and everything from the heart to the different parts of the body, while veins carry everything back to the heart. So what happens is if you don't treat the clots in the veins, they will end up with you will end up with clots in the lungs, and that will cause excruciating chest pain and necrosis and death. So that's why it's very, very important to diagnose the clots in the veins of the legs. Similarly, it is very important to diagnose clots or plaques in the arteries as well. So we'll talk more about it. What are the typical symptoms of peripheral artery disease? Typical symptoms, as they said, intermittent claudication. So this is very important. Intermittent claudication means that this happens when you are active and goes away when you are resting, while the pain of deep venous thrombosis actually sustains throughout the day. So this is how you can, maybe one of the symptoms or one of the differentiating factors between deep venous thrombosis and peripheral artery disease. So what are the other symptoms? A burning or aching pain in your feet and toes while resting, especially at night while lying flat. So this is another, so one is intermittent claudication, that's different, that's in the legs or buttocks when you are active, while there is another burning or aching pain in your feet and toes while you are resting, especially at night while lying flat. Cool skin on your feet, redness or other color changes of your skin, more frequent skin and soft tissue infections, usually in your feet or legs, toe and foot sores that don't heal. Toe and foot sores that don't heal. Half of the people who have peripheral vascular disease don't have any symptoms. Peripheral arterial disease can build up over a lifetime. Symptoms may not become obvious until later in life. For many people, symptoms won't appear until their artery narrows by 60% or more, which is actually again in contrast with the DVT, which is deep venous thrombosis, because even if there are small clots, you can have the symptoms, and then these clots can lodge in the heart and lungs. Because what happens is that they carry the veins carry the deoxygenated blood back to the heart, and then heart sends that deoxygenated blood to the lungs for purification. That's how you end up with clots in the lungs. So, what are the complications? Without treatment, people with PAD may need an amputation, because arteries are the ones that are bringing blood, food, and nutrients and oxygen to your parts. If your parts are not getting that, they may get dead, and then you would need amputation. The removal of part or all of your foot or leg, rarely your arm, especially in people who have diabetes, because your body's circulatory system is interconnected. The effect of PAD can extend beyond the affected limb. People with atherosclerosis of their legs often have it in other parts of their bodies as well. Okay. Now, does peripheral artery disease usually happen in one leg or both legs at the same time? Usually, it is unilateral, like at one side, but can happen bilaterally as well. Similarly, deep venous thrombosis also is usually unilateral, like on one side, but can be in both legs as well. So that's something we cannot differentiate DVT and PAD on. But yeah, so usually it is unilateral, but can be bilateral as well. So what are the risk factors? Okay, addressing the elephant in the room. It is tobacco, smoking. Smoking is the most important risk factor for PAD. So if we see a patient who has the symptoms of pain in the leg and then is a chronic smoker, we should definitely think about it. So tobacco use is the most common risk factor for PAD and its complications. In fact, 80% of people with PAD are people who currently smoke or used to smoke for a long time. Tobacco use increases the risk for PAD by about 400%. It also brings on PAD symptoms almost 10 years earlier. Compared with non-smokers of the same age, people who smoke and have PAD are more likely to die of a heart attack or stroke, have poorer results with bypass surgery procedures on their legs, and have a limb amputation. So then, regardless of your sex, you are at risk of developing peripheral arterial disease when you have one or more of these risk factors. Of course, tobacco, the most important or the most potent risk factor. Number 2, diabetes mellitus. Number 3, being age 50 and older, being an African American, having a personal or family history of heart or blood vessel disease, high blood pressure, definitely, and high cholesterol. Then abdominal obesity, being more obese towards the around your waist, and having a blood clotting disorder and having kidney disease. So these are all the risk factors of PAD. We will talk more about it tomorrow.